Hi everyone, welcome to Center of Balance Life. I'm Phua from Center of Balance, the acupuncturist. I'm just waiting for you to be connected. So today our topic is fertility testing for female. We're going to talk about woman. Tomorrow we're going to talk about men. We're going to talk about male infertility test. Okay. Today we're going to focus on. Hi Eric, how are you? The test of female infertility. So what sort of test? So we're not gonna run very details on that. We're gonna name some of it, give you some examples, things like that. And I'm planning to do another one which is more details. More details mean if it come to, like, for example, it come to blood, then we do the blood test, FSH test, and what is FSH and what does it do and what does it mean and when do you actually do it, all these details, okay? And LH, all this hormone test, it's very complicated, right? But it's simple, it's not easy to remember all those things, okay? If you want to be an expert of infertility treatment, and then you have to gain all this knowledge to understand everything, and because those tests are important, very important, and what they indicate with if they're low or high, things like that. If the patient, hey, this is important for you too, because you need to understand what the test actually mean for. Okay, of course, your doctor will give you the diagnose and tell you what's going on, but in here, we're not just giving you the diagnose, not just telling you what they means, and we're going to tell you this all these hormone things that you can naturally use in a natural way to balance it back to normal again, right? So you may thought about, well, I have this imbalance, then I have to do some drugs, or no, I can't do this, I have to go to IVF. That's not true. Okay, now there is a natural way to get your hormone back to normal. So all the tests we're going to talk about, just about all of them, not everything, or just about all of them, the test telling you that what's diagnosed of the disease, what's you suffer from, then just about all of the disease according causing the medical condition that causing the infertility, then we can use acupuncture and Chinese medicine to balance it and to help you improve your infertility rate. So this is a good news about it. But a proper diagnosis is important. We need to get the right diagnosis. Then when it comes to diagnosis, we can't go without tests. Okay, we need to do the test to help us to diagnose you as a practitioner here. So I want you to understand that. So as a practitioner, you need to all know all what those tests mean and what tests you need to get your patient to run to, to go through, So and you need to explain that to your patient. Okay, so we have a lot of patients who come in. We already have tests. Like yesterday morning, I made a couple in Auckland. Well, they have done some tests, but the funny thing is, people won't show you the test if you're an acupuncturist, because what happened is, they may show you the test when it's abnormal, but majority of the time that if the patient They went to the doctor, they went to the infertility fertility specialist, and the fertility specialist told them that, oh, all the tests are normal, and they will assume that everything's normal, then they won't bring it to you. But as a practitioner, I want to share with you, even though the fertility specialist say that the tests are normal, you need to see it yourself. You need to see it yourself. Okay. For example, morphology 30 years ago, it was about 40-50% standard. Okay. And now it dropped down to 4%. So as a fertility acupuncturist, we deal with this a lot and we know it. So what happened to you is, if the main sperm morphology is about 5 or 7, according to the standard right now, what will we do? We will say it is normal, but it's not normal way back in 30 years ago. You know what I mean? So what happened is, you want it to be increased, not just greater than 4%. That's not good enough. You want it to be higher than 10, at least higher than 10, and you get pregnant, all right, no problem. Okay, but the higher the better. And why would be the morphology is so low, which means the quality of the sperm is an issue. Okay, and that one, if they go to IVF, then the rate of IVF is still low, with low morphology, lower than 10. Okay, so you need to be in mind how to read those blood tests if you're a practitioner. Okay, I'm here to share with you and give you some information. Now, there are a lot of information, a fertility book that you can go through. I recommend one book. Let me the name, Kirsten Wolf, an Australian fertility acupuncturist. Let's see, what's the name again? Fertile Life. I think it's Fertile Life, the book's name. It's a pretty good book, a lot of information. Yeah, Fertile Life is the book. You can get ebook format online. Okay. What you talk about in virtual one, yes, we will talk about that. Good morning, Veronica. Thank you for your wishing. Happy Father's Day, and happy Father's Day for to your husband too. Cool. All right. Yeah, we will talk about IVF. There is a lot of things that we can talk about, to be honest. But yeah, we go slow. Just one by one and cover as much as we can. Okay. Now, I went to Auckland yesterday to Campo, and I actually had a couple patients over there for IVF. So which means for next Sunday onward, every Sunday when I go to Campo, and I have to go to a friend's clinic to do acupuncture and a fertility treatment for this couple. So as we go today, then probably I'm going to share some of the information or the test from this couple. Okay, let's start then. And if you're on Facebook, please give your thumbs up and say hello to me, and as well as tag your friend and family who suffer from infertility or who want to know about infertility information. Okay, and share my live video directly to your friend and family. If you can't take it in, or if somehow some reason that you can't do it, just share with them, or more importantly, share on your Facebook directly, because it will help more and more people to get the right information. Right? Thank you very much. Let's start. So a woman's fertility begins in to decrease following in age 30, right? A woman under 35 should visit a doctor after 1 year of trying to get pregnant. That's it. I mentioned it again. This is, we talk about 1 year. Way back there, and when I study, it's about 2 years. We talk about 2 years. If you try for 2 years, nothing happened, you go to see a doctor and discuss. Okay, now just 1 year. Okay, even though this under 35, this is a suggestion for from now. Okay, if you're over 35, okay, if you try for 6 months, not 1 year, 1 year is 12 months, right? 6 months, if nothing happened, then go to your doctor. Okay, well, it makes a bit of sense, because as you toward to 40, okay, and then the egg quality won't be good. Okay, so high chance to get infertility. That's about the egg quality. Okay, so it's important that now I would say, for me, for the woman side, if everything is fine, like, you don't have PMS, you don't have pain in the tummy and lower back, and you don't have clots, your period is on time, and you know when your ovulation time, and you don't have moody, emotional before period and during the period, and you don't have constipation or diarrhea during your period, and everything's fine, you don't have any symptoms. The reason I mentioned about all the symptoms is because too many females think that, well, having this symptom is normal because everyone have it. That's not normal. If you have those symptoms, hey, go to an acupuncturist, go to a Chinese herbalist, because they can help you. There's a symptom, then if you keep trying for about 6 months, hey, that's something that look at it. Okay, now if you have no symptom at all and keep going for trying for a year, and that's fine, even up to 2 years, in my opinion. No rush. Okay, if you're very, very unsure whether you're healthy or not, call in and we can help you. Right? We can help you review and give you some suggestion whether you need a treatment or not. Okay, we won't give you treatment if we can't diagnose, we can't find anything wrong with you. Doesn't make sense, right? Right. Now I've seen people that within 1 year, and they go to fertility specialist, and they couldn't find anything for them, and they just tell them to wait for, to keep trying, and that makes sense, isn't it? Keep trying up to 1 year or 2 years. Okay, but there are things that they can't find anything wrong with that, and just about 1 year, and they try to convert the patient to do IVF, and it doesn't make sense for me. Again, when it's nothing wrong with it in the test or in the skin, it doesn't mean that there's no problem, because it's, as I said again, period pain, PMS, those are the things that are conditions that indicate that they are imbalanced in the body. Okay, so they need treatment, but not IVF, Chinese medicine, or acupuncture, all together. Right? Now, as a practitioner, we normally take the first step that we take is the medical history. We ask all sort of questions. The main thing that we must ask, you can ask about the family history, you can ask about the bowel motion, daily bowel motion, you can ask about the sleeping, the stress level, whether they have tummy pain or not, bloating in general, acid reflux, what else? Sleeping, we mentioned that already. Urine, do they urine okay? Are they in a lot of stress? All these things. Try to ask all these things. Okay, we have a form that we tell patient to fill in, so we ask all this ringing sound in the ear, all this thing. Okay. Now, this is how you collect, how we collect information, how we collect information. Okay. Um, and we will ask about the main thing that we ask when it comes to fertility is about period. Okay, if in female, right, we ask about period. What is the things that we ask for periods? When did you start the period? Were there any pain or discomfort in lower back and tummy before period or during period? Okay, the amount of period, bleeding, okay, how many days, and the cycle, how many days does it last, and the cycle, 28-day cycle, 35-day cycle, this thing. Do they get tired after period? Yeah, before, during, and after, any conditions. Do they experience any what we call is pain or discomfort and ovulation comes? You see, all this question that I just mentioned are very, 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 very important for a fertility acupuncturist to figure out what's going on. Okay, if any of your practitioner or your doctor or fertility associate, fertility doctor, that then ask about your period and straight away run your test, and they run the test and they couldn't find anything, hey, this is no way. This is not the way to get your test. Okay, firstly, they must ask you period situation, and they even want to ask you, but did you get pregnant before? Is any miscarriage in the past? All these things are important for us. Okay, right? Then, of course, then we want to know about how did you, how often did you try? When did you try to conceive? To have sex? Because if you're not trying on the right time, then there's no way you're going to get pregnant, right? Then we're going to ask about other conditions or illness that could contribute to infertility, to female infertility. We talk about female tests today. Okay. Then we will perform an examination. Okay. Now, as a Chinese medicine practitioner, we lay you down. Sorry, this is needle in here, and we're gonna test to palpitate your tummy. Okay, palpate your tummy. Okay. I sometimes do it in the initial examinations. If I run out of time, it's too many things. Run out of time, I will do it if I got enough information, and then I'll do it in the first treatment. Okay, to check whether there's any lump, any tightness, any pain around the tummy. Okay, pelvic area. Okay, checks. So if it's fibroid, we can feel it sometimes. Okay, if it's big one, we can feel it. Okay, or any we ask the question about the pain, or female suffer from pain from while intercourse, and that is a sign of what? Endometriosis. Okay, or a sign of the inflammation of the pelvic. right? So those are important to know about. The history is very important before we uh, order the test. Now many people use ovulation kits, okay, to it tests you to see whether you're ovulating or not. Okay, it's it's very difficult to say whether it's accurate or not. Some of them rely on that and they go pregnant no problem, but some of them have trouble to track their ovulation through that. And we suggest uh, taking temperature every morning at a set time. Sleep at least continuing for 4 or 5 hours. Okay, then it'll be more likely accurate. Okay, um, so then for the chart BBT, basal body temperature chart, and it can tell that your temperature up and down, and the temperature up and down it represents that your hormone. So we test this for hormone. Okay, and it's very very important. Is the I think for me to say is the most accurate way to see the hormone. Okay, to see the hormone daily. Right, check that. Um, we rely on that. Okay, so apart from that, this is one of the tests that we look at that. Uh, Apart from that, there's a lab test, which is an ultrasound that it may use to examine the ovaries and uterus. Okay, ultrasound can see whether the uterus is fibroid or not, whether there is anything wrong in the uterus, and ultrasound can see that whether the ovaries had uh, polycystic polycystic ovary. You know, there's a lot of eggs that couldn't relieve that it become a lump in your ovaries. And is your ovaries enlarged or not? So the ultrasound may pick up that. Okay. Um, the other common test for women, uh, that's an X-ray. Okay, to see the fallopian tubes and uterus. Okay, um, that what I said is we need to check, and they need to check the tube whether it's tube blocked. We know when the what do we call it? Ovary ovaries when they release egg. You know, one side release one egg, and the other one the other side release. Okay, and they take turn alternated. Okay, they release egg, and the eggs need to go to the fallopian tube. And while they're on fallopian tube, and the sperm will come and meet with the eggs and become embryo, and they go through fallopian tube together and move to uterus to implant on the endometrium, which is the lining of uterus, implanted on the uterus. Okay, so this is what is going. But if the fallopian tube is blocked, what happened? The eggs couldn't go through the fallopian tube, and the sperm couldn't go through the meat, uh, um, the egg. So what they do is they actually injection something into it, some fluid, right? Then to take an X-ray to find out whether there's any tube or not. Because without the injection, the fluid go through. You have to inject the fluid go through the tube, and then you take an X-ray and to see whether the fluid actually go through the fallopian tube. And they have to do both sides. They take both sides. If one is go through, the other one not going to stop in some way, which there's a blockage in there. So acupuncture and Chinese medicine are very good Both methods are very good for unblocking the fallopian tube. Okay, so be in mind that we can do that. Um, laparoscopy. Laparoscopy is in which is use a camera to examine the internal organs. So this is important tool to use this for what? To go in and see whether there is any endometriosis. Okay, we talk about endometriosis, we talk about how to test it, how to diagnose it. Apart from symptom, you suspect there's endometriosis, but to really understand and diagnose it, to give the right diagnosis, you can't go without laparoscopy, because you need to go in to actually look at it, confirm there's an endometriosis in there. Okay, and to be honest, we can quite sure, okay, you have pain of this, you have all the symptoms, we're quite sure that you have endometriosis. You're just quite sure, you don't know, because what happened is the pain that you suffer from, it can be just a period pain, a period cramp, or inflammation. It doesn't mean you suffer from endometriosis. Okay, and on the other side is a silent endometriosis. People can't get pregnant and they have no symptom, everything is fine. Then again, when patient try for 6 months or 1 year of Chinese medicine and acupuncture, and everything, pain was bad and now all reduced and everything's fine, period on time, ovulation on time, we can track everything, and the BBT is good, 2 phases, very accurate, it's all good, and the man is good too, everything's good, and they've been trying for 3 months up to 6 months or even a year under the acupuncture and Chinese medicine treatment, then nothing happened. And now we, as in fertility acupuncturist, I would suggest you go and get laparoscopy to get further investigation. Does it make sense? Because they may have silent endometriosis. Very rare, but it happened. It happened. Okay, if they find out silent endometriosis, what happened? Clear it out. Simply use the surgery. And normally they would just do it. They would just do it directly. And if they find a serious problem, like it attaches a lot of organs and it's quite a major surgery, they won't do it. They'll close it and wait until the patient conscious, and then book and then discuss with the patient and say what's going on, what they found. It's very big surgery, and they want to talk about it and to see whether the patient want to go ahead or not, because patient hasn't got any symptoms. But just a minor surgery, they will just do it and cut those things, and then quickly, most of the time, quickly within 3 months before and pregnant, conceive, very quick. Okay, we see it in our clinic, and just want to mention it to you. If you're patient, you need to know about this. Okay, if everything's good, there's still potential to get endometriosis, but we don't know. We won't be confirmed that until the laparoscopy. Okay, so but just act like that is the last thing that we should go to investigation. Okay, not until you try for everything good, in the conditions of everything's good, you've been under acupuncture and Chinese medicine treatment, and everything's good. No period pain, period on time, no emotional, stress good, and no tired after period, or no cramp, no clots. Everything's fine. Then you've been trying for 6 months or a year, and nothing happened. Then suggest your if you're patient, you need to suggest your practitioner to do this for you, or your fertility doctor to do this for you. Okay, you have to raise your hand. I think, can we do laparoscopy, right? And you tell them the reason. Would it be silent endometriosis, and why don't you bring it up? They should think about it, consider that. They'll explain to you. They're expert and they're quite standard. Will understand why you want to do this. Okay, but if I explain to my patient, I will explain it very clearly and let them know what's going on, and they know what they face to. Okay, does it make sense to you? Right? If it makes sense to you, please put it down there. Yes, it makes sense. Okay. All right. We can keep going, and we just checking and say hello to others. Okay, we see that you are on YouTube. Say hello to me, please. And we can keep going. We can keep going. All right. There are some tests is testing the ovarian reserve testing. Okay, which use a combination of hormone tests to determine a woman's potential of conceiving. Relevant tests including the FSH, okay, follicle stimulating hormone, FSH test. Okay, there are few blood tests that you should get if you're a practitioner. I just name it. I'm gonna make another video for it to show everyone what is the test details on it, what's really on it. It's actually a blood test. Okay, in the blood test, you should in the container of blood tests, you test for the FSH, which we just mentioned, that follicle stimulating hormone, and test the E2. E2 is for it called estradiol. Estradiol. It's actually testing the estrogen level. Okay, and test the LH. LH is luteinizing hormone. Okay, and test the prolactin as well. So all those are actually made. Oh, sorry. The LH is actually testing the progesterone, and what I mentioned are all these tests just now, and you normally do it on day 2 or day 3. Day 2 or day 3. What's day 2 or day 3? Day 1 is the first day of your bleeding. That's called day 1. Okay, so you do it day 2 or day 3. They will test everything of your blood. Okay, for the hormone. Okay, there will be an accurate one. Okay, then when you test the blood test for hormone, there are 2 blood tests. One's called day 2 or day 3 test, the hormone test. The other one called day 21. Day 21. And the day 21, you mainly test the progesterone, which is LH. Okay. Why day 21? Okay, this is important. Okay, and a lot of doctor, especially family doctor, they didn't get the full idea of it. When they order, well, fertility doctor specialists, they won't get wrong with it. Okay, but they do miss something. I want to mention that it's important because a lot of people miss this one. It's very important if you're in acupuncture, fertility acupuncturist, to deal with fertility. You need to know this. Otherwise, you may think that the progesterone is normal. but it's not. Or projection is not normal, but it's actually normal. Okay, it's very important because we test the projection is because in the beginning of the implantation in the beginning of the developing of the embryo after implantation, it rely on progesterone, and if progesterone is low, and it can cause miscarriage, right? So yeah, it's good that you get pregnant, but now if you haven't got good enough progesterone, then the right level of progesterone, then it's not going to help you keep the baby. It's going to be very sad. Okay? But we can prevent this by doing the test before you pregnant, before you conceive. Okay? We make sure all these tests are normal. Then we know once you get pregnant, you won't get miscarriage. If we know that the progesterone is low before you get pregnant, then we need to treat you until your progesterone is high. On the standard, then we suggest now you start for your try to conceive. Does it make sense to you? If that makes sense to you, then put it down there, and I'm going to share with you more about progesterone. Now, okay, we talk about day 2 or day 3 test. Now we talk about day 21. What day 21 means? Day 21 test is mainly testing LH-rich progesterone. Now, the first thing, why call day 21? That is, if your period is 28 days, then you ovulation on day 14. Right? If you're a practitioner, you need to understand this. 28 days of cycle. If you're patient, you need to understand this as well. Otherwise, you don't know why day 21 test. 28 days, day 14 of ovulation, and after 7 days, that is 21, right? So which means day 21 means you do the test after your ovulation, 7 days after your ovulation. So we say day 21. Now, my question is, do all female, all women ovulate at the same time? Can you answer me? If you say that all women ovulate on the same time, please say yes. If you think that all women have a different cycle and they are not ovulate at the same time, please say no. So this is important. A lot of people didn't know that, didn't realize that. But of course, for patient we can understand, but for a doctor, I can understand that because they are not fertility specialists. So they just order the test for day 21, and they just put on their mind to suggest patient, and day 21 you go and do. They tell them that the first day of the period is day 1 and 21, and you go get another test. And most of the time I figure it out. My patient do day 21. I say they have to redo day 21. And what is the best time to figure out the day 21 is by taking the BBT chart. So use the basal body temperature chart to figure out when you're ovulating. Once you ovulate on that time, then we know we figure out that, and after 7 days you take the test. Okay. Let's say if the person is, the cycle is 35 days. So 35 days, which means on the day 21, they ovulated. 35 days of cycle. Every 35 days, they got a period bleeding. So which means day 21 is actually the ovulation date. Then they need to do the test for progesterone on day 28, not 21. And the 21 is just beginning of the ovulation, and you can't do progesterone and on your test the level on your ovulation date. Why is that? Because progesterone is producing from when the eggs release and what has left from the egg, and it called corpus luteum, and that is actually produce produce the progesterone. Okay, the progesterone level will high after because of release, and that things that cover the tissue that cover the eggs, and that tissue produce this hormone. Does it make sense to you right now? So this is very, very important. If you don't know about this and you're an acupuncturist or you're a patient, you look at the test, oh, it's normal, but it's actually not, because it's not doing in the right time. Oh, it's low, that's not good. You have low progesterone, no wonder you can get pregnant, because pregnancy, the implantation need the progesterone to help with it. But that may not be the case because you're not doing the day 21 on the right time. But does that make sense to you? So day 21, I want to particularly point out because I found it very commonly the doctor then tell the patient, go and test the right time in the right time. And they come to me and ask them, when is your period? Blah, 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 and I forget, oh, I'm sorry, this is not accurate. We're not going to follow this test, the report of it. Then what happened with you is you need to get your BBT chart first, and then I'll tell you, you can do day 2 for those hormones on any cycle of day 2 or day 3, but not for the day in the 21. Day 21, I'll let you know when to, once you start your cycle and take the BBT chart, and I'll let you know how to take it, when to take it, when to get the test. Okay, when to go and get blood test. Does that make sense? Okay. Well, this is something that you should do, and if you're a patient, this is something that we do. Okay. If you're a practitioner, you have to remember this, right? Right. That's it for today. Thank you for being here with me today, and tomorrow we're gonna talk about the male testing, infertility test for male. For men. Okay, it's a simple. We cover some notes for you to know, to understand what's going on. Then more details about the blood test, to be honest, and more details about how to diagnose PCOS. We're gonna put it on PCOS things, and we're gonna talk about very clearly what blood tests you need to go through and what they mean and everything in another chapter. So today it's just an overall things. Okay. If you have any question, put it down there and let me know your questions. And otherwise, we'll see you tomorrow. We're gonna talk about infertility test for male. So stay awesome, and I love you all. See you. Bye bye. You're welcome. Now, if you're a patient of us, or you live in Hamilton, Auckland, or Cambridge, and if you watch this video and you suffer from infertility, or if you want to get any infertility knowledge. And we actually offer a free pre-assessment up to 15 minutes that is free. Or you can fill in a form that is $135 that if you come to us, but we give you the free thing that you can fill in a complete form and come in for initial examination that only costs you $40 for an hour. We'll go through everything and look at your test and everything, and to let you know what's going on and give you a plan, to give you a diagnosis according to Chinese medicine, and give you a plan. What plan do you need, and how much will it cost you? What's your expectation for the cost? Does it make sense to you? If you do, you can call us 0784679956. Stay awesome, and I love you all. See you tomorrow.